Typically, when I have a patient that comes into my office, and the first thing I do is assess their age. So like we said before, one of the risk factors for breast cancer is advanced age. So as women are in their 50s or older, breast cancer becomes more top of the mind. Somebody in their 30s or 20s who come in and tell me they have lumps, especially around menstruation, could be a benign condition, and it could just have something to do with their menstrual period. And typically what many of us internists will do, will ask the patient to come back during menstruation so that a physician can actually assess the lumps and see if it's something to worry about, or to see if the lumps go away. And if they don't go away, then we start to think about a cancerous situation. With regards to screening, now most folks around the world will tell you to start screening women with mammograms. Annual mammograms typically happen after the age of 40 for us in our practice. We couple that with a clinical breast exam done by a physician, and we actually start that clinical breast exam in the 20s. 20s, we start checking women for breast lumps, and till about 39, we do this every 2 to 3 years. The reason why we don't do mammograms before the age of 40 is because women have lots of fibrous tissue before the age of 40, and it's very difficult to detect breast cancer with a mammogram before that point. Now, there are alternative methods to look for breast cancer in women. One of the methods includes an MRI. MRIs typically are not done. They're a little bit more on the expensive side, but that is another mechanism that can be requested or paid for by the patient if they were so interested. Now, once a mammogram is done and a possible mass is detected, typically an ultrasound will also be done. Sometimes a patient or a doctor will use something called a fine needle aspiration test, which is a needle that is directed towards the lump or the bump in the breast to look for cancerous cells. It's not 100%, sometimes cells are missed. So then the decision then is made, depending on risk factors and whatnot, whether to proceed with a biopsy. Now, a biopsy at that point is usually done under the supervision of a surgeon, as well as consultation with a hematologist oncologist, and then it is determined whether or not further studies is required or further treatments are